Today, we're digging into a really tough public health challenge, the high rate of stillbirths in Sub-Saharan Africa. You know, a new major systematic review has just come out, and it's sifted through years and years of different interventions to figure out what actually works, what truly saves babies' lives. And let me tell you, the answer is probably not what you're thinking.
So let's just start with a number that should stop all of us in our tracks: 42%. Back in 2019, Sub-Saharan Africa carried the burden of nearly half of all global stillbirths. We're talking about almost 1 million silent tragedies. It's a staggering and disproportionate weight on the region.
Okay, just so we're all on the exact same page, let's use the official definition from the World Health Organization. A stillbirth is the death of a baby at or after 28 weeks of pregnancy. And getting this definition right is so important because it really helps us zero in on the specific things that can prevent these late-stage losses.
Now, for decades, the public health world has, very logically, poured a lot of resources into community-based programs to try and fix this. And yet, that number just isn't coming down as fast as it should. So this begs the big question, the one these researchers wanted to answer. With all this effort happening at the community level, why aren't we seeing the results we expect?
So yeah, let's first take a look at this community-first approach. For a long time, it's really been seen as the most logical way to start tackling this crisis. And the thinking behind it makes perfect sense, right? For so many women, especially in rural areas, a hospital can be way too far, way too expensive, or just impossible to get to in time during an emergency. So these community programs were designed to build a bridge over that gap, to bring critical information and support right to people's doorsteps.
So what are we talking about exactly? What do these programs actually look like? Well, it's a whole mix of things. It could be women's groups sharing health tips or training for traditional birth attendants. It might be sending health reminders on mobile phones or having community health workers do home visits. The goal, always, is to get women connected to the health system sooner and better.
But here's where the story takes a turn. When the researchers pulled together all the data from all these different efforts and analyzed it, they found something really, really surprising.
The researchers boiled it down to one simple question. Do these community-based interventions all by themselves actually reduce the number of stillbirths? The evidence came back with a very clear and honestly pretty unexpected answer.
So after pooling the data from 13 different studies, the finding was just stark. These community-only interventions, they just weren't making a statistically significant dent in stillbirth rates. I mean, sure, they were raising awareness, they were getting women to go for checkups, but they weren't on their own, saving babies at the scale that's so desperately needed.
This visual here, this forest plot, shows you exactly what they found. That vertical line in the middle, that's the no-effect line. Each of those horizontal lines is a different study. But the really important part for us is that diamond at the bottom. That's the combined result of everything. And you see how it's touching and even crossing that no-effect line? For anyone in policy, that's a huge signal. It means we just can't be sure there's any real effect happening. The odds ratio is 0.96, which sounds like maybe a tiny 4% reduction, but because it crosses that line, it's just not statistically significant.
But, and this is a big but, the analysis didn't end there. And this is where we get to the real breakthrough, the part that shows us the path forward.
The whole picture changed completely when the researchers started looking at a different set of studies. These were studies where the community outreach was paired with real efforts to strengthen the local health facilities. You know, things like training staff better and getting them better equipment.
And this second plot shows the difference perfectly. Just look at this. This represents the studies that link community work with stronger hospitals. See the diamond at the bottom now? It is way over to the left of that no-effect line. It doesn't even come close to touching it. This, right here, is the evidence we've been looking for. This is a clear, undeniable, statistically significant impact.
And how big of an impact are we talking about? A 17% reduction in the odds of stillbirth. That is a massive life-saving difference. It basically proves that a community program on its own is like building half a bridge. It's almost useless unless it actually connects to a capable, high-quality health facility on the other side.
So this isn't just some interesting academic finding. It gives us a clear, urgent directive, an imperative, really, for anyone in policy, anyone funding these programs, or anyone implementing them on the ground.
The study's authors put their conclusions so clearly that I'm just going to read it to you directly. They said, community-based interventions alone, without strengthening the quality and capacity of health facilities, are unlikely to have a substantial effect on reducing stillbirths in SSA. It's just that simple. So what's the takeaway here for you? It's a really clear two-part strategy. One, we absolutely have to keep investing in community outreach. It's critical for identifying risks and getting women to seek care in the first place. But, and this is the key, all that effort is basically wasted if the clinic they show up to isn't ready and able to provide the high-quality care that will actually save that baby's life. The two have to go hand in hand. One creates the demand and the other has to be there to meet it. You know what this research does? Is it moves us beyond the old arguments. It's not about choosing community versus facility anymore. It's about community and facility, working together seamlessly. The evidence has laid out a clear path for our investments and our policies. So really, the only question left for all of us is, how will we act on it?